especially women also face the fact that they learned very early age that they had to mask their symptoms and actually adapt them to what is socially acceptable. So most women, for example, bite nails. This is some kind of hyperactivity they have, or they want to do like this, but they do it in the feet, like very hidden, or they eat here inside, or they twirl their hair a lot. You know, like small movements that you won't see or you wouldn't associate with ADHD, maybe more to anxiety. And that's why some of the women get diagnosed so late, because they have been collecting depression and anxiety diagnosis way first.
Hi, Joanna.
Hi.
Thank you so much for joining me today. We've been friends for a while. We met in our mid-20s, and we recently both turned 30. How was the turning point for you? Did you feel any difference? Were you any scared about turning 30?
Actually not. It was more scary to turn 29, I think. Because turning 30, kind of settled me down, I think. I'm really excited for my 30s and excited for everything that's coming. And I don't know if you read these memes, but 30 is like 20s, but with more money. So that's actually true. And so far, I've been enjoying it. It's been my first year, also a very tough year, but nothing to say bad about this new year.
Yeah, I think it's so funny how society makes women think that actually turning 30 is when your life kind of stops, or like, yeah, you're supposed to achieve these things by the time you're 30, but in fact, it feels like your life starts, and then like you're more aware of yourself, you're more confident. So I feel like, yeah, you're right that 30 is like 20s, but better, with more money and then more confident.
Absolutely. Obviously, I've been thinking as well on like planning family and stuff like this, but this hasn't been like my main focus, and this is still not my absolute main focus in my 30s. It is part of my 30s, but it's not why I'm scared of or why I'm happy to turn 30. It's more about self-fulfilling.
So you didn't feel any pressure about achieving some kind of things by the time you turn 30?
In some way, like more like professional goals, I think. On that topic, I've been feeling a little bit of pressure, but just because I want to get things done. You know, I've been studying for quite a while. So, yeah, I'm happy to soon be done with that.
So what are the things that you learned in your 20s that you apply in your 30s?
Being patient with myself, I guess, that being patient with myself and with other people. Also to still keep focusing on my goals, because it's easy to say that when you're in your 20s, but you don't have like specific goals yet. I was just in my 20s figuring out what I didn't want, actually. So I feel like now in my 30s, I'm more like, going towards the goals and the stuff I really want in life.
Another aspect also for me was letting go of perfection.
I like to say that we are a system inside of us, and we have different parts of us, and sometimes there is a perfectionist part, but it also has good intentions because it wants to keep you driving towards goals, obviously. But sometimes it takes a little bit too much space, and then obviously can also cause trouble in everyday life. But perfectionism is something I think a lot of women struggle with. Yeah.
And in our 30s, we actually learn to take care more of ourselves, I think.
Mm-hmm.
And I recently heard that when women are more egoistic, it's more profitable for everyone. And I think it's so true, because when you focus on yourself, and then when you're happy, you're more energy to give to everyone around you. So everyone actually takes advantage of this.
Yeah, absolutely. But still, society, when you see women being very self-aware and being very, yeah, how do you say, very confident, society sometimes mistakes it with arrogance or is more shocked about it as they are with confident men, for example.
Yeah.
That's what I've noticed recently in some media.
So the reason I invited you today is because you had your master's degree in clinical psychology. And I would like us to talk today about the neurodiversity in women. So for those who don't know what the term is, could you explain what neurodiversity is?
Yes, so neurodiversity is like the big title for the diverse society and the diversity of brains we have in our world and society. So there's a difference between the terms of neurodivergence and neurodiversity. So neurodiversity means everybody, like all of the different brains we have. And neurodivergence, for example, means the brains that are not part of the neurotypical norm. And actually we have different neurotypes. And some of them are, for example, ADHD, autism, dyslexia. Those are different neurotypes.
I feel like it's quite a new term, neurodiversity, neurodivergence.
I think the term has came up like the last 5 years, I would say, a lot more because of media and because people were talking about it. And as everything, for me, I feel like neurodivergent people are profiting from the fact that it's more into media because it raises awareness on neurodivergence and neurodiversity. So it's really important to talk about it and to actually show that there are differences and in brains in working systems. So I think it's a good thing that actually we're talking more about it.
I think it's also more inclusive than just calling people ADHD or autistic.
Yeah, and when you go back to the roots, actually, it's something like when we go back to ancient times, there were already different neurotypes, right? There were the hunters and the gatherers. And when we talk about, for example, ADHD, which is a neurotype that can be prone to impulsivity, but also has a lot of awareness, not so much sense filter, so every senses go into the brain. And those were like the hunters. They got dopamine from hunting and from moving, and they had to move and they had to be quick, they had to be impulsive. And the problem is we are living in a gatherer society. So putting brains that need to move and need to be impulsive into a gatherer society where they have to do 9-to-5 jobs is a problem. And it shows because some of them can face big troubles kind of trying to fit in the system.
Okay, so ADHD is one of neurodivergent diseases. How can you call this?
It's a neurodevelopmental. It's not a disease. It's a neurodevelopmental problem in the brain, which is caused by a problem of the dopamine functioning in the brain. So there are neurotransmitters, and there's not enough dopamine here in the frontal lobe. And in the frontal lobe, we have executive functionings. And we need all of these capacities in everyday life to plan, structure, organize, remember stuff. And when there's not enough dopamine, and dopamine is known for being the neurotransmitter that is kind of pushing us to do things, motivating us to do things. And when you don't have that enough, you're facing executive dysfunctioning in everyday life. And that makes it hard, for example, to plan ahead, to stay on task, to keep focusing, to remember, to regulate emotions and impulsivity, for example.
You had a lot of practice with children.
Yes.
How easily is it to recognize ADHD? And is it different in boys and girls?
It's very different in boys and girls. And that's the knowledge we have only for, like, I would say 10 years. It's a very US, like, they do a lot of studies about it. And so slowly it comes over to Europe, but we have been like blind about this for many, many years. And so all of the diagnostic process for ADHD, for example, as I work with people with ADHD and especially women with ADHD, all of the stuff we use to do the diagnostic process are based on men norms, on men symptoms. So some of them don't recognize themselves 100% in the tools we use. So it really needs to have a bigger overview on also women ADHD symptoms.
Also because our brains are wired differently, men and women.
Absolutely.
I think we have more busy the emotional part of the brain. That's where women get more depressed than men. So obviously the ADHD symptoms differ in women and men. Also,
hormones play a very big role. The cyclus plays a very, very big role and can impact ADHD symptoms a lot. Yeah.
So is it a genetic disease or can you develop it through your life?
There are different hypotheses, and I think we're still far from knowing 100% how it develops or what are the parts. But it's ADHD is genetic. So when you have ADHD, there's a high chance at least one parent has ADHD as well in some form, or maybe grandparents or aunt. And usually when I ask that question, we kind of find as well other people from the family having ADHD or at least symptoms of ADHD. And then it's genetically, but it's I also like to say it develops in a biopsychological and social context. So it's very multifactorial how it develops, and if it's early onset, if it already shows when you're very little, how it shows, the severity of the symptoms that can show, or if it's even late onset. I like to say a girl with more like the dreamer type, like ADD, what we called, when she grows up on the countryside, having school like Montessori school, having parents that are very structured, giving her structure, and she goes, I don't know, horse riding. She has a lot of creative hobbies. She won't develop a sense of the symptoms impacting her negatively in her life.
She won't.
In the first years.
Okay.
Imagine then her going into big city to study. That's where she will have to structure herself for the first time all alone. She will face the first time having to organize herself all alone and being overwhelmed by everything in the city and maybe not having the resources she had back then at home. Everybody caring a lot for her, giving her structure. So that's why sometimes women face late onset symptoms. So some of them are very, very good at school and they have very good reports. So it's hard to kind of see the symptoms early onset, because also ADHD comes often with also high intelligence. So
but also there are different type of ADHD, right? You think like there are 6 or 7 of them?
Well, there actually we're kind of also moving away from the ADD types because actually it's all ADHD, but the hyperactivity can be more restlessness inside. So it doesn't have to be like motorical restlessness, but still the diagnosis is ADHD, and then you can have the type that is more unattentive, you can have the mixed type, and then you can have the more hyperactive, impulsive type.
Because I think we used to associate ADHD with hyperactive boys.
Yes.
Which is not only this, right? It can be also you being stuck on your thoughts, or like also being obsessive about something, not really being hyperactive physically.
Yeah, absolutely. I have some patients that are like the opposite. They're hyperactive, so they feel like they're facing executive dysfunctioning can show in kind of feeling paralyzed, actually, not being able to do things. So this also means sometimes you feel like you're stuck, like physically. Some of them have, especially women, also face the fact that they learned very early age that they had to mask their symptoms and actually adapt them to what is socially acceptable. So most women, for example, bite nails. This is some kind of hyperactivity they have, or they want to do like this, but they do it in the feet, like very hidden, or they eat here inside, or they twirl their hair a lot. You know, like small movements that you won't see or you wouldn't associate with ADHD, maybe more to anxiety. And that's why some of the women get diagnosed so late, because they have been collecting depression and anxiety diagnosis way first.
So can one start another? Like, can ADHD make you more anxious, more depressed?
Yeah.
They're related?
Absolutely. There are clusters, and ADHD unfortunately has a high rate of comorbidities, and the top 3 are depression, anxiety, and substance abuse. And unfortunately, science, but also my experience shows that more people have comorbidities. More people with ADHD have comorbidities than I know people with ADHD that don't have comorbidities. So a lot of them have depression symptoms, anxiety, eating disorders, for example, and also OCD, because OCD is like the opposite from, can be a compensation strategy, a coping mechanism to feeling a loss of control of the chaos you sometimes have to face with ADHD.
How do women feel in your experience? Are they relieved? How do they take the diagnosis?
It's very mixed, and as you say, it can be a relief at first, but usually people go through a process that can be kind of compared to grieving. Because you go through very mixed emotions. You go through sadness, you go through anger even. Why didn't my parents see it? Why didn't everybody see me suffer? Why did it have to come that far? Why did I only get diagnosed with 35? And but then also comes the state of acceptance, and the state of acceptance and the relief of finally having an answer to issues they were facing their whole life, and kind of building up on this new reality for them.
Yeah, and I think they start to learn themselves and how to move forward, maybe with this diagnosis.
Absolutely, it's a big part of self-acceptance, so they can finally start to accept some parts of them, and also take some stuff with humor, obviously, which is better than always blaming yourself for a lot of stuff. And in my experience, what has helped the most is talking with other neurodivergent people. The self-help groups or self-help communities are a big part of the relief that can happen after a diagnosis.
Are there a lot of communities like this?
Yeah, there are more and more. Gathering on different social platforms, even organizing stuff, social events in real life. I think it's great. yeah, it's amazing how creative they are also in the ways that they are meeting.
How do you go from the diagnosis to treating the patients? Like, what do you do to help them?
ADHD is one of the only diagnoses that can be treated very well with medicine, for example. There are big guidelines in the world that has been made about it, and usually people are going towards double treatment. Like, some of them want to take medicine, some of them don't. Some of them can't because they just don't get along with the medicine. But when they do, it's great that they also do psychotherapy, because in psychotherapy, the things you can address in psychotherapy have a lot of topics on self-esteem, for example, or self-structuring, or impulsivity. For example, a lot of them are facing social issues, not being able to keep up with friendships, or having a lot of conflicts. And there you can learn in psychotherapy how to get better at that, actually. And I have made amazing progress with a lot of women in that field. Also, therapy groups, because if you do a therapy group with women with ADHD, you also have already the self-help part, because they're sharing what they're experiencing in life. And then you can commonly do different exercises, emotional regulation, breathing exercises, or, for example, impulsivity exercises to, like, kind of stop, think, and then act, stuff like this. So yeah, there are a lot of great tools in psychotherapy to work with neurodivergent people, but there are not enough therapists that actually are specialized, or that are willing actually to work with neurodivergent people. I feel like some of them are on their guards, and they're really reserved, and they don't feel so sure about the diagnostic process and stuff like this. But it's actually amazing to work with them.
Why do you think is that? Why they're so reluctant to work with?
Because one factor can be, or is probably, the fact that it's ADHD or neurodivergence is called a fashion topic at the moment. So I think some of them, we have different areas in psychotherapy, and some of them don't work with also new scientific findings. So that's why some of them are more prone to say, ADHD is due to trauma in childhood. And that's not a theory I go with. I think that a lot of people with ADHD experience trauma in childhood, unfortunately, but it's not the cause of their ADHD.
So do you specialize in treating ADHD in women, or do you do both?
I do both. I do diagnostic process for children, adolescent, and adults. But the fact that it has been ADHD has been underdiagnosed in women, in adult women, shows in my work, because a lot of them, are getting a diagnosis at the moment.
You told me also a story about the woman that was relieved and felt like she could finally be herself.
Yeah, I have a lot of patients that really, really touched me over the years with their story, and with what they have been going through, as well as I can, of course, relate to some of the stories, because I've been diagnosed myself with ADHD 3 years ago. And so it's making my diagnostic process a little easier to, like, kind of relate to what they are talking about, but but also to kind of know that it is a relief to get a diagnosis for many women.
Also, I think it would help if society could look at neurodivergency as it's not a deficit, but like differences. Like we're all different, we all have different brains. It's not that people with ADHD or autism have some kind of deficit, but their brain is wired differently.
Yeah, I love to explain to my patients that as well as we have different computers, systems, right? We have different ones. We have ones that are easier, more structures. They have a very, very high, long battery. And then I always say neurodivergent brains are more like gaming PCs. Like they can take a lot of information, a lot of updates, have like high working programs, but then they can crash very easily. And as well as there are different softwares, we have different softwares in our society, like in form of neurotypes. And so this part of acceptance in society is, I think we're still behind, but we're going towards it.
Also, I think it's important to acknowledge the good sides that go with it, because I think also people with ADHD or autism, they can maybe be better at some things like analyzing or other areas that people with normal brains wouldn't be especially good at.
Absolutely. And like in the after the diagnosis, I always try to focus on also the resources that come with having a brain that works sometimes faster, and there are a lot of very, very positive facets of the ADHD brain that come with it. And unfortunately, some people with ADHD need to find out about them and need to kind of go from the deficit-oriented and the self-stigmatization. For example, I'm dumb and I'm lazy. That's what a lot of people with ADHD think. Going towards, I have difficulties in some areas, but I'm very creative. I'm very good with people. I'm very social, and I'm very resilient. People with ADHD are very resilient.
It would also help that the workplaces would recognize different type of personalities or like disabilities.
Been noticing some progress already in that area, because some of some big companies are already going towards including neurodivergence, doing workshops on neurodivergence, and there is one company in Germany that is specified in recruitment of neurodivergent people. So of course, the people that want to work with neurodivergent people have to make some adjustments to the usual 9 to 5, big office, shared office spaces. So they have to adjust to the needs of the neurodivergent person, but what they gain is like it's worth it. It's they gain more from it than the adjustments they have to do. And we have in Germany, we have a disability degree that people can apply to, and which I always encourage them to do, because it's a little hint towards society to say, well, hello, you need to do adjustments and we need to change some things actually.
Do you see any difference between France and German work environment towards disabilities?
I haven't been working in France for like the past 5 years, but leaving France, leaving Paris was kind of also for that reason, because I felt like there was less inclusive workspaces here. And so I think there's simply the fact that psychotherapy is paid through social insurance in Germany is a big fact, and it's not in France. And that's a major, major problem for me and for everybody else, I think, as well.
You also work with autistic children, right? Mm-hmm. So what is autism and how do you recognize it?
Autism is also a neurodivergence, and it's also a neurodevelopmental disease. It's autistic people face different issues in the social area, social communication area, into as well filtering senses. A lot of them are very sensitive to light, to sounds, to smells. In the society, there's always a lot of stigmatization about autism, and some of them is that autistic people are not empathic or stuff like this. But it's like basically all of the opposite. They're very rational and organized thinking. But some women, for example, they can be too empathic, and they easily cry, for example, when they see some films they like or stuff like this. So there are a lot of stereotypes in society about autistic people that have been going on through films and series. But I feel like more and more autistic people are also being loud and talking about their symptoms. And if you know one autistic person, you only know one. So they can be very, very different, and that's why it's called a spectrum, because symptoms are not the same. There are no degrees, no severe autism. It's a spectrum, and some of them face social problems. Some of them face other problems. It can be very, very diverse.
What's the ratio? Does it touch the same girls and boys, or?
It used to be, I think, 4 boys for 1 girl, but that only, a hypothesis, I would say, is that the girls are just not diagnosed properly. Because here, again, we have all of the criteria of autism are based on male autism, male symptoms. And as I said, they can show very differently in women. And so we don't have the proper tools to diagnose autistic girls at young age, actually.
Yeah, I think you're right. When they show the autistic people in films, they show already like a very severe autism, and not, as you say, that the spectrum is so broad that sometimes people with slight symptoms, they don't recognize themselves, or people don't recognize them as autistic. That would make them maybe more excluded from society.
Yeah. Actually, 40 to 70% of people with ADHD have autistic traits. But usually, and we talk about this also in the diagnostic process, I do some screenings and stuff like this, but we also talk about the fact that if they do the diagnostic process for autism, they might not get the diagnosis because they have autistic traits. And from the tools we have, they might not score the actual severeness that is needed for the diagnosis, which is...
And as you say, we tend to mask some symptoms.
Yeah, autistic women with ADHD are the number 1 maskers, and that's why they get very, very lately diagnosed. They usually come between 30 and 45 to get the diagnosis because they have been collecting burnout after burnout. And and they finally don't want to mask anymore, and they through social media they are finally seeing themselves in some of the people that talk about their symptoms, and they're recognizing themselves in the symptoms, and they get encouraged to actually go into the diagnostic process and not keep on masking those symptoms.
So they mostly already come to you seeing the difference in their behavior and thinking that there's something wrong? Or what's the ratio of people feeling like they know the diagnosis already, and when they come to you and they just have no idea, have no clue what's wrong with them?
The ratio, actually, I feel like all of them know. And usually I also ask, since when have you been going through that thinking, and many of them say, yeah, it has been years, but I didn't knew it. I didn't have the words for it. I didn't knew it was autism, because when I thought about autism, I thought about the film Rain Man or Sheldon Cooper, and that's not me. So I wasn't thinking, okay, I could be autistic. And and when other people appeared in social media talking about their symptoms, about them being autistic, about them having ADHD, then they were like, okay, wait a minute, that's me. And then they get into the diagnostic process, and many of them are scared. They are scared that their symptoms won't be seen, and
or they will be judged.
Or they will be judged, especially exactly because many of them think that they're wrong. They think that they don't fit into society. Some of them feel like they're on the wrong planet, and they never fitted into society, never fitted into groups. And one of my main goals is to kind of giving them the feeling of being seen and heard.
Mm. Also, I think maybe that they may think that the society would find that they find excuses for the behaviors or not being perfect in whatever area of the life you're aiming to.
Yeah, I always say neurodivergence is never an excuse, but it's an explanation. It's an explanation, and and it should be an explanation you could or should give also to people around you. For example, to your family or friends, when you can't keep up with messaging them, when you forget their birthdays, when you stuff like this. And as I said, it's not an excuse, but it's an explanation. And sometimes, it also helps to heal some relationships over the years, because the neurotypical friends start to also be aware of what their neurodivergent friend is going through or facing.
I feel like it might be a big part of therapy, including your partner, your family in the dialogue, and then understanding what the neurodivergence is.
Absolutely, yeah. When I work with the kids, obviously I try to gather the parents and the school, even the teachers, to be on board and to kind of work together. And when they're adults, usually I also invite their partners for the last diagnosis explanation, and usually they enjoy having their partner there, because they are profiting from somebody explaining the symptoms to their partner as well. And I have had a lot of positive feedbacks about, for example, marriage counseling, like people specializing into neurodivergent marriage counseling, because it's a big topic.
Also, I think the problem comes from society thinking that there's one normal type of the brain. Actually, I hate the word normal, because there's not such a thing as normal. Yeah. Also, it depends where you grew up, in which culture, in which country, because every society has its set of rules or understanding what normal is. And if we just let go of the word normal, I think it would include more people. And I think it would open the conversation to what type of personality or disabilities you can have.
Yeah, and that should already start in kindergarten. Should then go to school to look at each individual and to see the needs. What does this kid need? Where are their strengths and where are the weakness? And then to on that build a plan and and for them to actually know their strengths and weaknesses and work on, of course, challenges, and choose also a career path that is matching them.
Yeah, also I think we should start looking at health as a holistic part, because it's so crazy. Like, we only, when you do a health checkup, you only do the physical checkup, you never look at the brain. And I saw that there are, I think United States, there are some clinics that you can actually look at your brain, look how it works, and well, physically look what's wrong with your brain, which I think would help the diagnosis.
Yeah, there are a lot of also progress is being made in that area, especially with AI. For example, there are different studies that show that you could, in the future, maybe diagnose a neurodivergence through eye retina scan, and it comparing it to other neurodivergent people. In this study, I think there were like 98% right. That's crazy. Wow. But of course, working with brain images there was no evidence made that it should be part of the diagnostic process, because the images are still not truthfully or like giving an evidence about which areas of the brain are impacted. But we know, for example, when you scan a brain with ADHD, you will see here in the frontal lobe, as I said, the executive functioning, you will see that there is less movement in that area.
And also, as you said, people mask their symptoms, so you can't really trust them when you try to diagnose them. So when you look at the brain, I think you can see that their behavior must be related to, the past injuries also of the brain.
Yeah, absolutely. Like trauma also impacts brain. And when we talk about the neurodivergent umbrella, there are also, for example, personality types under it, like borderline. There are PTSD is under the neurodivergent umbrella as well, because the brain is wired differently after a trauma. So yeah, actually there are a lot of factors that come together and make it hard to only prove neurodivergence through medical assessment.
Can women get PTSD?
Yes, of course. A lot of them have PTSD. It's PTSD is a trauma reaction. It's a post-traumatic trauma reaction, and it comes with having experienced either for a long time, repeatedly trauma, or having being exposed to a traumatic experience, or there is also like you can experience it through somebody else experiencing trauma. For example, you can get PTSD from your parents having faced some traumatic.
Really?
Yeah.
Okay, so you can mirror.
There are different degrees. Okay. Like 2nd degree trauma would be that.
How do you treat it? Like just therapy?
Trauma therapy is a big I think number one. For trauma, it can be hard to diagnose trauma, because again, a lot of people with trauma symptoms are also masking and high functioning, but experiencing, for example, panic attacks or nightmares or dissociation in everyday life. And sometimes when you look at traumatized children in class, you can think that they could have ADHD symptoms, because they can appear similar, because they also can be hyperactive, but it's more of a hypervigilance. And when you treat the trauma, then the symptoms kind of minimalize, and and then you can see whether it was ADHD or not. But as I said, also a lot of people with ADHD are more prone to experience trauma, actually.
So apart of ADHD, autism, and PTSD, what are other types of neurodivergency?
Dyslexia, for example, there are different forms of it. I don't know the exact term, but there's the same thing as dyslexia, but for math and for numbers. I have that as well, for example. There are different neurotypes. For example, Tourette is one as well, where you get tics or reactions that you can't control.
So it's related to brain, Tourette.
Yes. Yeah. It's there are a lot of nice documentaries about it where people talk about their neurodivergence, and I think it's very important to talk about the differences between the neurodivergences as well. Some of them can have similarities, but some of them are also very different.
What was the earliest that someone was diagnosed with ADHD or autism in your experience?
That's hard to say because for autism, I have worked with very, very small children as well, like 3 years old, for example.
What were the signs, the symptoms?
The symptoms were a lot like some of them were not talking, some of them couldn't keep eye contact, some of them wouldn't react when the parents called their names. Some of them would have strong eating disorders, like being very picky eaters, only eating the same things, doing like having stereotypical behavior, like for example rocking a lot, or arranging toys, arranging stuff, having very specific interests, like I don't know, for example, the metro lines. Those are very typical symptoms I'm talking about right now, obviously. Like no, not typical, but stereotype symptoms. But I have seen some cases, and that's obviously the children that get diagnosed early onset, because they show a lot of the criterias.
How hard is it for them to open up? Because if they're not talking to their parents or like natural surrounding, I imagine that talking to someone from outside would be even more harder.
Yeah. Some of the assessment is done with the parents. Some of the assessment is done by also kind of watching them in their natural habitat, how they interact or not interact with people, for example. Like I have been working in a school, and I went in classes to like kind of
examine
it in class, see how they behave there and stuff like this. So sometimes it's not, of course, one part is also seeing the interaction you have as a practitioner with them, but also how they are in everyday life.
What's the standard therapy?
A big part can be, well, there has to be actually you have to analyze the specific needs. If you have an autistic person that has issues with social cues, issues with social communication, issues with finding friends, getting into a group, keeping eye contact, having a conversation, then, for example, there are programs that are about learning social competence. So this can be one focus into the therapy, but also a lot of emotional regulation and a lot of self-acceptance for the symptoms.
I think that also it's much more difficult for women to be aware of having a disability, because there are different standards that apply to women than to men.
I think women, as I said, they mask a lot of their symptoms. That's why it's a lot of them didn't get a diagnosis when they were children. and especially ADHD women, for example, which is the combination of ADHD and autism, because they're highly masking a lot of symptoms because they learned that actually they are different, and to mask the difference, they, for example, copy, imitate the behavior of other people, which also makes it hard to find your own identity during life. And so a lot of them are struggling with finding themselves and actually knowing what they like. Some of them even copy the kind of way others speak. For example, I have one patient, she told me every time she's into a friend group, she talks like the people are talking there, and then she also dresses like the people are dressing there to kind of fit in and to not feel different.
So it makes an issue with finding your own identity and knowing who you are.
Yeah, absolutely.
If you could change one society expectations about women, what would it be?
The list is very long. The list is very long, but I think the main one would be actually to be feminine, like the stereotype of a woman. She has to be feminine and everything that comes with being feminine, like, I don't know, wearing makeup or having long hair or stuff like this. And for me, it's just like, I think it doesn't make any sense for me to connect being a woman automatically with being feminine. You can also express femininity in different levels, or have your own definition of it.
Yeah, but it's also different in different societies and different cultures. Like where I grew up, you have very strict roles and idea of what feminine and masculine is.
And also, it doesn't always have to be like so put
strict,
into box. Yeah. It can be fluid. At one point, you can feel more feminine, and then you can also have feel a little bit masculine. That's also what non-binary people are kind of facing. So to not be so harsh in putting things always in categories
and boxes. Yeah, I think just let women be whoever they want to be.
Let us be.
Yeah, and don't put standards that are not achievable. Like I think there are so many women in their 40s and 50s that put these new standards out there, which is so nice. Like, for example, the way women age. Like there are so many beauty standards that are different for men and women. Like, for example, men with gray hair when they're in 40s or 50s, they're perceived as handsome.
Yeah.
When you have a woman that want to age gracefully, naturally, then society asks, why didn't she put the color in her hair? And why does she do this? But I feel like whatever we do, we're always judged. So
women can't win.
Yeah, no. But let's hope these standards can change and we all can become more inclusive.
Yeah, there are a lot of amazing women out there fighting for that every day. And there are amazing women in light and producing content and working on that. So, I'm hopeful.
Yeah. Thank you so much for joining me today and for
You're
the conversation.
You're very welcome. It was so nice to be here with you. Thanks for the invite.